and then we'll pick it up from there, don't you think?
Yes. Whenever you're ready.
Okay. Maybe Nicole, oh, you're recording. Okay, great. And maybe mute folks too. So my name is Jessica Kahn. I wanted to welcome everybody to our workshop this afternoon. I'm the co-principal investigator on a grant from the Health Resources and Services Administration, which is providing financial support to 29 of our graduating students and is also helping us facilitate these workshops. Amanda Silberman Borgia, who maybe could say something so that she lights up a little bit.
Hi, welcome everyone. Thank you for being here. We're excited about this.
Amanda is the principal investigator on the grant, and we're very happy that this allows us to provide these workshops. There will be one more workshop this semester in November, and that is going to be about the similarities between COVID and the HIV epidemic. And then we will have another workshop in the spring semester and a conference in the spring semester as well. So we're hoping that as many folks can join for those events as possible. A few housekeeping issues to address before we get started with introductions. We are going to be monitoring the chat, but we're going to have the presenters focus on their presentations. So we will be answering questions from the chat at the end of the presentations. So feel free to ask any questions or put any comments in the chat, but please note that we will not actually be addressing those at the time, and we will be addressing those at the end of the presentations. For those of you who are licensed social workers in need of these free continuing education credits, which we are happy to provide for those of you who are licensed social workers. If you did provide your license number when you registered, we will be sending you an email with a certificate. It generally takes at least a week, maybe 2 weeks to get those out to everybody. So please be on the lookout for those from us in the next couple of weeks. So without further ado, I would like to turn this over to Crystal George Moses, who is on faculty in the MSW and the BA program at Lehman College, to do some introductions for this afternoon. Thank you.
Thank you. Good afternoon, everyone. It is good to see you here. I have the privilege of introducing our speakers today. I'm going to start with Mimi Abramovitz, Dr. Mimi Abramovitz, who happens to be one of my mentors, but she has mentored several faculty members here at Lehman College. So Dr. Mimi Abramovitz is the Bertha Capen Reynolds Professor of Social Policy at Silberman School of Social Work, Hunter College, and the CUNY Graduate Center. She is often introduced as an activist and a scholar, which I'm sure you will attest to that at the end of this workshop. She is trained in community organizing and social policy at Columbia School of Social Work. Dr. Abramovitz currently co-leads the National Social Work Voter Mobilization Campaign, also known as Voting is Social Work. Her research interests include U.S. welfare state, poverty, inequality, activism, and the impact of public policy on human service organizations, all viewed through the lens of race, class, and gender. Widely published in social work and often interviewed by the print and broadcast media, she is the author of several books, including Regulating the Lives of Women, Social Welfare Policy from Colonial Time to the Present, published by Routledge. She is currently writing a book entitled Gender Obligations, The History of Black and White Low-Income Women's Activism Since 1900. Mimi has been honored with 15 awards, most recently CSWE's Significant Lifetime Achievement Award. Alberto Cifuentes Jr. is an LMSW. He will be our second speaker. He is a member of the Vote-er Healthy Democracy team and a doctoral candidate graduate assistant at the University of Connecticut School of Social Work. His primary areas of social work interest include criminal justice reform, LGBTQ rights movement, sex worker rights and health, HIV, STI prevention, and sex-positive social work theory, education, and practice. He has spent much of his professional career advocating for underrepresented and marginalized communities through direct action, community organizing, social justice education, and social service program implementation, enhancement, and evaluation. He is former co-chair of the Board of Directors of GLSEN Connecticut, a safe schools advocacy organization where he led multiple programmatic, fundraising, and professional development initiatives. He currently serves as founder and chair of the Macro Social Workers Network of NASW Connecticut and co-chair of the Latina Social Workers Network of NASW Connecticut. Our third speaker will be Cheryl Aguilar, LICSW and LCSWC, a licensed independent clinical social worker. She is the founding director and therapist at Hope Center for Wellness, a multicultural wellness practice focused on holistic healing. In her clinical practice, she addresses depression, anxiety, trauma, grief and loss, adjustment, family separation and reunification, among other challenges. She is passionate about micro, meso, and macro work. She founded and co-leads Social Workers United for Immigration, a network of social workers committed to the well-being and advancement of immigrants. Because of this work in 2019, Cheryl was recognized as one of 10 dedicated and deserving social workers making an extraordinary impact across the country by Social Work Today magazine. Once again, we welcome our speakers, and we will begin with Mimi Abramovitz. Mimi, you're muted.
Okay, I'll start all over again. Hello, everybody. I'm really excited to be here, and I'm also excited about the topic of this workshop, which deals with what I'm calling voter activism and resilience, because they really are connected. And I'll be focusing more on the voter activism side, but you'll see the connections to resilience as well. So slide 2. So I'm sure you all know that a healthy democracy depends on accessible, inclusive, and an accessible and inclusive electoral process, and that voting is the most democratic right in our society. But it has not, we wish for this, we've had some of it, but it has not been easy to get there. It took the pressure of social movements. Next. First, it took the women fought for the right to vote. And this is a picture of Ohio Women's Suffrage Office in 1912. And it has been 100 years since that victory, just about 100 years in 2019. Next, the Civil Rights Movement fought for the right to vote. So we put these two together. It took massive political struggles for women and persons of color to win the right to vote. And for those who are old enough to remember this, you know what the costs were and what the victories were. Some of you, it's news and we don't have time to go into it now, but you should check out that history. Next. This is a picture of LBJ, Lyndon Baines Johnson, president, signing the Voter Rights Act, 100 years, 100 years. I can't underscore that too much. After the Civil War ended slavery, 100 years. Next. So here are some of the things that this famous and important act provided. It prohibited discrimination in voting. It expanded the franchise to more young persons, more low-income people, more white persons and persons of color. And these are the groups that we served, that social workers served. So it was really important to our constituency. Next. So what are the benefits of social work? Why are we so worked up about what's going on with voting today? Well, it has individual, community, and professional benefits. For individuals, voting, and this really relates to the efficacy question, voting is associated with higher levels of health and mental health, stronger social connections, better employment outcomes, and a greater sense of individual efficacy. So individual resiliency is enhanced by voting. For communities, communities with higher voter turnout receive more attention, quicker responses, and greater resources from legislators than communities with low voter turnout. I'm sure most of you have experienced that in your work with individuals and communities or heard about it. And the third is it has benefits for the profession of social work, because voting, if the social work of NASW can say, our memberships vote, and we have very high voter turnout among our members, our voice and our visibility are enhanced, and then they get more support and better response to what they're lobbying for the programs and services that benefits our clients, social workers, and society. There's more on the website for all these things. I'm going to give you a tour of the website a little later, but these are three really, really important ways that voting and high voter turnout benefits us. Next. And yet, we have a voter turnout problem in the United States. Although robust voter turnout is fundamental to this healthy democracy we're talking about, the power of the vote remains to be actualized. Many do not register, others do not vote, both of which have serious consequences for all of us. Next. I'm going to talk a little bit about this. Why aren't people registered to vote? Well, it estimated, as you can see in the slide, 51 million eligible voters and more than 25% of the eligible population were unregistered in the last election. That's 2016. And here are the top 4 reasons research and surveys have found. This is from a Pew poll from 2017. People said, I don't want to vote, so I don't need to register, 44%. I intend to register, but haven't gotten around to it. The candidates or the issues don't inspire me, so why bother? And I don't want to register for privacy or security reasons. So a lot of people stay away from the vote, and our campaign is trying to convince them to do otherwise. Next. So I don't know if you can, this has very small print in it, but what it basically says is that high bar at the end represents 62% of the people say they were never asked to vote, never asked to vote by anyone. The small bars are asked by a teacher or by a religious leader and so on. But 62% were never asked. And this is where we come in. Our job is to ask people who've been registered and get them to register to vote. Next slide. Another problem is some people just don't show up. There are 100,000 or so eligible voters. Of these, 42% did not vote at all in the last presidential election. And so the largest block of citizens in our presidential election, as this little bar shows, if you can read it, are people who did not vote or did not participate in the election at all. It says that 27% voted for Trump and 28% voted for Clinton, but 42% did not vote. Just imagine how their vote might have been split and what might have been different. These voters are more likely to be lower income, less educated, persons of color, unmarried, often ignored by the campaigns. And also, turnout is lower for local and state elections. And in the United States in 2018, we ranked 26 amongst industrial nations in voter turnout. For example, 90% in Australia, Belgium, and Chile turned out, 80% in Austria, Sweden, and Italy, and 70% overall, the average for all industrial countries. We are at 26%. Shame on us. Next. And not only shame on us, but the consequences are rather amazing. So here's a comparison of 2 different elections when the voter turnout made a big difference. And basically the point is, every vote counts, and that recent elections have been won by very small margins. Therefore, every vote counts. So in 2016, you can see Trump won by 0.2% or 10,000 plus votes in Michigan, Pennsylvania by 0.7% or 46,000 votes, and in Wisconsin by 0.8 or 22,000 percentage points. If you add these all up, it's about 79,000 plus votes, 46 electoral votes. And this researcher said that if Clinton had done 1 point better in each state, 1 point better in each state, she would have won the Electoral College as well. 1 point in each state. Let that sink in. It's such a small margin. In 2000, some of you may remember the Bush versus Gore and the hanging chads problem. That was 2000. So Bush won by a 540 margin in Florida. That swung the Florida election. That swung the election. Those 540 votes swung the election. The final gap, Florida swung the election based on those 500 plus votes. The final gap between Gore and Bush was a little over 500,000 points nationally. I cannot say that your vote counts, that every vote counts, and please spread the word. We have 3 weeks to the next election. You can hope this information will help motivate more people to vote. Okay, next. So why don't people vote? Why don't people vote? So I'm going to look at individual structural barriers and voter suppression. Next. Individual barriers. So a survey of some 4,000 persistent non-voters aged 25 or older nationally found that these are some of the reasons that individuals did not, personal reasons that people did not vote. They lacked time. They lacked transportation. They weren't engaged with the news. They felt uninformed. They don't know who represents them. They lack knowledge about how to vote and where to vote. They lack knowledge about the candidates and their positions. Less informed and interested in politics. And so these are reasons that we also found in our study. We did a study of the campaign participants, and they found many of the same things why people don't vote. Keep these in mind. These are the things we have to overcome if we're working on voter registration and getting out the vote. Next. Social workers too. So in our study, which is listed below, found similar views among social workers. We are not exempt from these reasons. They told us they lacked information about politics and government. Raise your hand quietly to yourself if you fall into that category. They think their vote doesn't make a difference. Social workers think their vote doesn't make a difference. They feel like the candidates do not represent them, which in many cases makes sense. They feel like politics is not for them, and they don't trust the political system, something that is going to be an increased factor in this next election. So social workers, we have some work to do in our own ranks about overcoming these thoughts. Next. What are some structural barriers? I want to distinguish between things that stop people and things that are put in front of people that they have no control over. So what are these structural barriers? Think about it. Given the importance of the vote, the voting process should be simple, convenient, and fair to everyone. But it isn't. All these structural barriers exist. People can't get time off from work to vote because we vote on a Tuesday. Different this year, but in the past. They lack transportation. Well, if you're in New York, we have mass transportation, but if you live in way out in suburbia or in a rural area, that's a big problem. You face long lines if you when you go to the polling place. The deadlines are confusing. They're different in every state, maybe different in different cities. It's really, really confusing. You may be asked to produce an ID in some places, but not in others. You may not know what the ID requirements are. Some people have a felony record and they're disenfranchised in many states. Physical challenges make it difficult to get to the vote, and language barriers. All these things, you would think that we could take care of these in a country as rich and famous as we are. But these are chronic problems. They're not new now. They've been around for a long time, and they have reduced our voter turnout. Next. But the But today, perhaps we're hearing much more about voter suppression, and I say voter suppression by design. Voter suppression, I'm going to go over this a little bit in detail, but voter suppression is by design. It's not accidental, and it's people seeking to reduce access to the vote by those who view it as a threat to themselves, their power, their privilege. So it's not accidental or simply a matter of inconvenience. Those who view fair access to the ballot as a threat have been actively trying to suppress the vote. Okay, next. Here are some of the voter suppression goals. I'm going to start. Carol Anderson, who's photographed there, she is Charles Howard Candler Professor of African Studies at Emory University, and author of One Person, One Vote, White Rage, Voter Suppression. She's an expert on voter suppression. And she says that voter suppression is designed to demoralize the electorate, to make people believe that voting does not count, doesn't matter, to make people think the system is rigged and that your vote doesn't count. Voter suppression is designed to do all the things that we just heard people say why they don't register, why they don't vote. And as you can see from the barriers, the effort of voter suppression has succeeded. Next. So voter suppression has a long history. You probably have heard about poll taxes pressed on the very poor, especially people of color in the South. They've been asked to identify and say the number of jelly beans in a bowl, impossible things that no one would know. You may even heard of incidents of extreme racial mob violence that goes beyond the daily police violence that we've been hearing about today or other acts of violence in communities of color. But you may be surprised at the extent and duration of this horrific practice. This map, which maybe I'm going to give you some examples, shows Black massacres, often in relation to voting or trying to exercise rights between 1863 and 2015. Next. So in 1868, 200 recently emancipated African Americans were killed by a white mob in Opelousas, Louisiana, for registering voters. In 1919, some 237 Black farmers in Elaine, Arkansas, were lynched for organizing their labor to negotiate, for better working conditions. In 1921, Tulsa, many people have heard about Tulsa, it's been gotten attention recently. Tulsa in Greenwood's neighborhood was, Tulsa's Greenwood neighborhood was bombed and burned to the ground, leaving some 300 people dead. At the time, it was the wealthiest Black community in the country, earning the moniker, the name of Black Wall Street. In 2015, this you've probably heard about, a lone white supremacist in Charleston entered one of the country's oldest Black churches and shot 10 worshipers in cold blood. And you've heard of a lot of other ones since then. This is on the rise these days and is very scary and disturbing. Next. So jumping to the near current period from 1970 to 28, this is the period of conservatism. Some people talk about it as I do, neoliberalism and so on. What was going on? The social movements that had won victories to the vote and other important rights were attacked. The trade unions, the civil rights, the women's liberation movement, and others, they were attacked and their victories undone or tried to be undone. The 1965 Voter Rights Act was never well enforced. It was poorly enforced, and this was not unintentional. We still provide too little or false information about candidates and issues. Think of how the press covers the latest fight, struggle. They don't talk about the issues and what's important to most of the people. We have lots of untrained poll workers, and no one did much about that. And we ignored the problems of absentee ballots, voter registration, and malfunctioning voter equipment. These things are longstanding problems. They are now being addressed. Some of these things are beginning to change with this historic election that's taking place, but this has been going on for all those years. And why? Because the people who were threatened by large voter turnouts were worried that young, low-income, and persons of color were known or assumed to vote for a liberal or Democratic candidate. So there was a power fight going on. Who was going to control the vote? And they upped voter suppression. So next, please. So since what's been going on since 2008, after the election of the nation's first Black candidate in 2008, all hell broke loose with voter suppression. Many states passed laws making it even harder for people to vote. The Supreme Court, very much in the news today, undid key voter protections that ended oversight of states who violated the Civil Rights Act. And now, as soon as that was undone, the violations reappeared with a vengeance. And this has been justified by the myth that voter fraud is widespread, especially in mail-in vote and absentee ballots, there's no evidence, as you know, to prove that. Next. What are some of the current voter suppression tactics? Dwell on this because it's really, really important. I hope you agree that this is the thing that is really posing a challenge and a risk to our democracy. Can't go over all these things, but gerrymandering voting districts to favor the party in power, sweeping, purging people's names from the voter registration list, ending early voting, introducing more and more complicated voter ID laws, disenfranchising felons, removing or relocating polling and voting sites, and sometimes down to one in a district. Campus violation, intimidation, slowing down the delivery of the US mail. I hope you've been following that story. Cutting short the time for collecting census data. Why is that important? Because the census enumeration determines how much money each of our district gets, who's counted in the population, which groups get counted and served. It's so important. If you haven't done it, you better hurry up. And all of this has fueled enormous distrust in the election outcome, which is really, to me, very, very troubling. And next. Okay, Nicole, we're gonna do our video. It won't work from, I don't think it'll work from there. You haven't. This is John Lewis speaking to our topic.
Born in 1968, and
So young.
Yep, so young.
Yeah, and I feel very much this. I'm also the son of immigrants, and so I feel very much this sense of generational obligation. I basically have done nothing. I won the lottery being born in this country when I was born. I didn't have to do any of the things that you had to do. I didn't have to do any of the choices that you had to make. And I would like you to explain to people, not only my age, but to the young people in the room, how it is that we should define this generation's challenges that we should be willing to put ourselves completely on the line for, and how we in this age where it's not as stark as troopers standing on the bridge every day, how does this rising generation find and summon that same courage to stand up and fight the way that that you did, Congressman?
Well, I must tell you, you're much better educated, you're better informed. You know, all this new technology. We didn't have a fax machine. We had one of these old mimeograph machines. Just turn. You have an obligation, your generation, young people have an obligation, a mission, and a mandate to push and pull and not be satisfied and do everything possible. I tell young people all the time, I spoke at 7 college graduations this past season. And I said, the 3 young men that I met and got to know, they didn't die in Vietnam or the Middle East, or Eastern Europe, or Central South America, or in Africa. They died right here in our own country. And I hear too many people say, I'm not going to participate. That's not my cause. We have to participate. Politics control everything that we do in America, from the time that we're born into the time we die. So you have a moral obligation, a mission, and a mandate to get out there and push and do everything you can to leave this little piece of real estate we call America a little greener, a little cleaner, and a little more peaceful for generation yet unborn.
Next,
Oops.
Nicole.
Yeah, it's coming.
Okay. So no, not yet. First, hold there for a minute. Okay, so what I think is really important when we hear about voter suppression and we hear John Lewis talk, we should never forget that what has been done can be undone. Change may be an uphill battle, but never forget what has been done can be undone. Next. And see, it's starting to happen. This is a line, I think in South Carolina, people lined up to vote, some waiting 8 hours to vote. This is unprecedented. It's a historical change. So this gives us hope that what we're talking about today, this shows resilience. It shows that what is done can be undone. And it's really, really important. As of yesterday, 15 million people had already voted. 15 million in person or in person, probably mostly. I don't think they've counted the mail-in ballots yet. So despite all the depressing information I just gave you, there's hope. Next. Why social work? I'm going to give you 6 reasons why social workers should get involved. Next. 1, it's the right thing to do. Next. We are in the right place. We are located between the individual or the intersection between individual and society. This positions us extremely well to do the work of the voter registration. According to Angela McLean, the Chief Executive Officer of NASW, social work serves some 12 million clients every day, about a quarter of which don't vote. And so we work on a field placement model, right? And the the voter campaign, which I'm going to tell you about in a few minutes, made field agencies the hub of our voter mobilization campaign. It was a natural place. Next. I mentioned these before, but I want to mention it again. The reason we do it is because voting brings benefits to individuals, communities, and to the profession. Next. It supports the mission and social justice values of social work. I'm not going to take the time to read them, but NASW Code of Ethics and the CSWE practice competency standards speak to this and mandate social workers to do this. Next. And we have a long track record. There's another reason. We have dating back to the 1930s, 60s, and 1990s, and even earlier. Next. This is a cover of a proceedings of the National Conference of Charities and Corrections held they're available online from 1880 to 1982. And they were meetings of what the forerunners of organizations like NASW, where social work organizations from around the country came together to talk about what was going on. And our paper in the Journal of Social Work Education, we have a report on what they found. And periodically, and a lot of times, they were addressing this issue of voter urging people to go out and vote, the same thing we're doing today. Next. Some of you, if you're in the older generation, may remember the Human Serve campaign. This was led by Richard Cloward and Francis Fox Piven. At that time, both of them were on the faculty of Columbia School of Social Work. And they organized this campaign to register clients in non-profit organizations, not just social work organizations around the country. They also helped to pass the National Voter Registration Act, popularly known as the Motor Voter Act. This was signed by Clinton in 1993, and it said, you're allowed to register voters at the Motor Vehicle Bureau. But Piven and Cloward, being good social workers, although Piven was a sociologist and a political scientist, they said, but not everybody has a car. And what about poor people? So they were responsible for this act being extended to government offices, public sector, public assistance offices, and so on. Remember, they were involved in the welfare rights movement at the same time, earlier. So picking up, next slide. So that's a 2 present. Next, So this National Social Work Voter Mobilization Campaign, which we started in 2017, is really standing on the heels, on the shoulders of the Human Serve campaign. Next. People always ask me, why did I get involved in this campaign? Well, I'll tell you briefly. When I was younger, I was not always I was one of those people that wasn't so enthusiastic about voting, given the choice of candidates. I didn't feel like they represented me, etc. But I also participated in the civil rights movement, valued its victories, especially the right to vote. So when voter registration raised its ugly head, it broke my heart. It really did, and it tore me apart. So when my colleague Terry Mizrahi asked me if I would join her to create the National Social Work Voter Mobilization Campaign, which we call Voting is Social Work, I yelled, yes! Next. What are the goals? The campaign is voter engagement and mobilization. We basically we're working to mobilize school, faculty, students, fieldwork directors, field instructors to register clients and constituencies, especially those targeted by voter suppression and gerrymandering laws. Next, the campaign was endorsed by all the major social work organizations almost within a week or two. We were stunned because if any of you work with organizations and get approval to endorse someone else's activities, you know it can take weeks, not months. People jumped on, the major ones, and then others heard about it and called us and said, can we endorse, including the clinical social workers, which really delighted us, but surprised us. Next. As I mentioned before, we made fieldwork the hub of our work for the reasons I mentioned before. Next. So our activities included that this campaign is largely volunteer and unfunded. We use the website, Voting is Social Work, a series of webinars, voter registration material distributed to agencies and schools. Through all these, we mobilized and prepared social workers and interns around the country to register themselves, clients, students, as well as family and friends to vote. So now I'd like to give you a little quick tour of the website. So I think I have to share my screen. They're telling me I can't, oh here, can you see it? Can you see it?
No.
It's telling me I can't share it while others are participating. Nicole, can you help me with this? I'll try to do it again.
Should be able to do it now.
Okay. I'm not getting that share screen on. Okay. All right. Here it is. Okay. Can you see it?
Yeah.
No, I can't see it. We practice. Oh, here it is. We practice this, folks. We really did. Okay. So here is the website. So the menu across the top is very important. Here's pictures of our leadership, so you see who we are and little bios. That's not most important. Voting resources. If you can use this, show people to check their registration, to register to vote. So to check the registration, it takes you to places that you can. If you hit this, it takes you to like Turbo Vote and other places. Okay, it actually allows you to register to vote. Let me go back here. So it's basically a toolkit. This whole website is a toolkit. Campaign resources, like the schools of social work, which you are, we have all sorts of information, best practices for integrating, additional resources, and annotated bibliography, all sorts of, all available for a click, okay? So this is, and then we have it for field education students and agencies as well. We want you to use these, that's why we're doing this. Oops. We also want you to get involved. If you want to sign up on a mailing list, please, everyone on this call we're invited to sign up. You'll get our regular emails. If you just go to the this particular place on the website. Whoops, oh, did I just lose it? Is it still there?
No.
No, I did something. I clicked the wrong thing. It went away.
And you can click in the center of your page there. Click the one. Yeah, there you go.
Nicole trained me with this, but it's all my fault, all these problems. Okay, so get involved. You can also pledge to participate. You can sign up and say what you might do. And this is important. You might also submit a story. Those of you who've been actually doing things, we're trying to collect your stories. You can do this and give us permission through the dots below. Write up your story, and we'd love to hear about it. We want to get a lot of, oh, I did it again. Oh, a lot of stories. Okay, and then we have some information on this, the census. I think I'll stop here, but just you get the gist of it. There are all sorts of things that you can do. You can join the mailing list here, pledge to participate, and so on. So this is just a teaser, stopping sharing. Okay, so now where are we up to? We're up to next slide. So we also spend a lot of our time, the campaign does.
Hold on, Amy, you have just a few more minutes.
Okay, I'm almost
Just letting
done.
you know.
I'm done, okay.
I
So-
had the the thankless task of being the timekeeper for this, so forgive me.
We spend time refuting myths that keep social workers and others from voter engagement. And this is really important. The next. One myth is that voter registration on the job is illegal. This is not true because of what I told you about the National Voter Registration Act. And so I mentioned this earlier, that this is what the act does. I'll save some time. Next. This is really important. Voter registration is a partisan activity. The fact is that the Hatch Act, which people heard about but don't know really what it does, defines permitted and unprohibited activities of federal and other government employees. So you may and may not. So you can assist a nonpartisan voter registrar, attend rallies, meetings, fundraisers, sign nominating petitions. The thing you can't do is be partisan, endorse a campaign, campaign for people on the job, and so on. Next. So you can make a difference, and here are the ways that you can make a difference. You can raise awareness of the importance, link voting rights to social work issues. There's all sorts of information about that on the website. Organize voter registration drives and activities like this one at your school, agency, field placement. Invite candidates to speak. Inform everyone about candidates' election dates, and so on. Help register people to vote. Remind them to vote and get out to vote. Become a poll worker on election day. And make voting rights and voter mobilization skills part of your classroom and field assignments. And we are starting, the campaign is urging schools to make voting November 3rd, election day, an excused absence from students in the field so they can go get people to the polls, they can volunteer to be a poll worker and so on. So that I don't know if your school's doing that, but it's something hopefully you'll talk about. Next. I'm almost done. And basically, this is what you can do. You can speak out. Your vote is your voice. Next. And you can support fair vote social policies, mail-in votings, ranked choice voting, ex-offender enfranchisement, make national voting days a holiday, campaign finance reform, and so on. Next. Enter COVID-19. All this was true before COVID-19. So COVID-19 has laid bare problems in our social, economic, and political systems. COVID-19, along with the Black Lives Matter movement, especially if not only in the welfare state. It has reshaped the voting and entire electoral process, as you know. It has canceled conventions, digitalized fundraising and campaigning, forced many states to rapidly change how people will vote, register to vote. And we don't know what the results are going to be because of all the tumult around this. The pandemic and the press for racial justice has refocused our nation's attention, brought issues like public health, economic and racial inequality to the fore, prompted the public to revisit what characteristics we want in our leaders and how we want to organize and strengthen the electoral process and all of our democratic institutions. How can we protect them? It will test individual, community, and professional resilience. Back to the point of this workshop. Next. So I'm going to end by saying, as I hope I've convinced you, voting is power, voting is a human right, voting is social work. Next. Be part of the solution. Join the National Social Work Voter Mobilization Campaign. Be part of history. Thank you.
Mimi, thank you so much. That was really inspiring. Can everybody hear me now? I'm just checking since, okay, good. Okay, I see some clapping and everything. That was really great. And one of the things that I wanted to highlight just before we move on to the next part was what a perfect bridge your talk was between the different areas of social work, the macro, the meso, and the micro. I just felt it really engaging and inspiring. So thank you for that. I also want to mention that several of our students are poll workers and are, doing a lot of sort of reflective criticism on their experiences and bringing that information into the classroom. And we have many policy classes where I'm sure this is coming up. But one of the ones that I teach is policies with older, policy affecting older adults. And I just wanted to make the point that, it is interesting to me that over the life course, the rates of voting do in fact increase. So older people tend to be have higher rates of voting than younger people, which I think is something to remember as well. So that we're going out and we're trying to vote, get all the young people to vote, and remember that older people count too. That's my own little plug. But
say one thing, if you have stories from your students, either you or them, if with their permission, post them on our website, because then we're going to do something with that.
I'm going to get everybody I know to fill out your website form. So there you have it. So that was great. Thank you. So we will have some questions and answers at the end. But before we get to that, I want to reintroduce Alberto Cifuentes Jr. He is going to be our next speaker, and he's going to talk again a bit more from the macro perspective. And then our final talk will be more about the micro perspective. So I can't actually see Alberto right now on my screen. So let me make sure he's there and ready to go. And I will, great. I will mute myself because I'm absolutely no tech help at all. And Nicole will take it again. And I also want to give a big shout out to Nicole. Thank you, Nicole, for all the support you've given us on this workshop. Okay, that's it. I'm muting.
Hello, everyone. I'm so happy to be here. I'm so happy to be talking with you about one way you can mobilize the non-voter, especially with Vote ER. So before I do that, I'm going to talk a little bit about why I decided to join Vote ER. It was about mid-March. COVID had hit, and I'm an organizer. I'm a community organizer by trade, and I didn't know what I was going to do with myself. Not being able to really talk with people that much, be in close contact with people. How is it going to be able to organize? I felt pretty powerless. And then Tanya Rhodes-Smith, who's executive director of the Nancy A. Humphreys Institute for Political Social Work. She's also part of Voting is Social Work. She talked to me about Dr. Alistair Martin, who had founded Vote ER, which I'll tell you more about in a second. And I connected with him, and the rest is history. And fortunately, he was inspired by a social worker to create this tool, which is mostly used by medical professionals. It's mostly used by hospitals and nurses. A fraction of social workers currently use it, but I'm going to try to change that and try to expand social work's usage of that. So now I'm going to share my screen. And start it. All right, so I am the team lead of the social work team. I supervise 2 interns, MSW interns from Boston University, who help me with social media and drive the vision for how we want social workers to engage with Vote ER. But first, I have to tell you what our vision or our mission is. We envision a more inclusive American democracy. And what I mean by inclusive, I mean that all voices, including those that are marginalized, those that are disenfranchised, are included in decision-making, in electing officials, in deciding what kind of infrastructure we have, that everyone's voices are counted. And our mission is to create a future where those most hurt by our healthcare system, we know that our healthcare system isn't perfect, far from it, in fact. But we know that we can create a future that where those most hurt by the healthcare system are empowered to fix it. And we do this by inviting their voices into the democratic process. Often in social work, when we talk about interventions, we talk about involving the actual clients, the actual communities that we're trying to help, involving them in the creation of the intervention. We know how effective this is in actually creating healthier communities. So that's why we want to invite these voices, everyone's voices, into the democratic process to repair our broken healthcare system. We have 3 core beliefs, all supported by research. One, that voting is a social determinant of health, that the more voices we have in communities, the more empowered voices we have in communities, the more healthy outcomes we'll have. We know that voting, based on the research, is linked to healthy outcomes, physical, emotional, mental, spiritual. We know that. And so we're using that to say, hey, we need to include more voices. We need to increase people who are registered so that we can have healthier communities. Second, we know that voting gives people voice. We believe that by voting for our health, we can actually preserve what works and also change what doesn't, and have more voices heard, so that it's not just the chosen few who have power to make decisions. Marginalized communities, those communities that are disenfranchised, can also inform decisions. And lastly, more voices build better systems. We know that when our healthcare system is strong, both providers and patients have say. They all show up. So in a sense, we're trying to get more marginalized communities, especially there are 3 main populations that don't often vote. They're what I call Generation Z, 18 to 25, people of color, and those that are low income, those that make less than $30,000 a year. Those are the populations that often don't vote, but those are also the populations that often feel like their voices don't count and that they shouldn't vote because their vote doesn't matter. So we know that by not voting, you are affecting the health of your community, you are affecting your healthcare system. So we want to build more voices to help build better systems. Together, VoteER has helped over 40,000 people get ready to vote. So this has to be since about late March, early April. 40,000, the number keeps growing. Every week that we have our weekly meetings, the number keeps growing. And this is something that we're really proud of, that we've been getting over 40,000 people, mostly in medical establishments, healthcare centers, hospitals, to either register to vote or to check their mail-in ballot that they can vote by mail. Our founder, Dr. Alistair Martin, he is an ER doctor with the Massachusetts General Hospital in Boston, hence VoteER, because this is where this began. And he tells the story of VoteER like no one else can. I'm going to give you a really watered down Reader's Digest version of it. Essentially, a patient came, she appeared to be living from her car, she had children, she needed help. And he didn't know how to provide that help, especially since she didn't have any kind of form of ID. And he talked with a social worker, because social workers are supposed to know this stuff. And she said, well, is she registered to vote? Is your client registered to vote? And he said, and that's when the light bulb hit. That's when he got the idea, oh, I need to create some kind of connection between voting and health. And so I love this story, not just because it shows that a social work was the catalyst for this, therefore we should be engaged in this work, but also that we can link our healthcare system to making sure that people have a voice, that people have a say, and that people are registered to vote. So with that, I'm going to actually, this is all the very technical. I'm going to show you the hows of how we've used devices, these mechanisms. And one of them has been site-based. One of them has been a computer on site at the hospital registering people to vote, has been very successful, and is in several hospitals. But the one resource that most social workers have been using is this right here that I have around my neck. It's the Voteyard's badge backer and lanyard. And the badge backer has two really important things. One, it has a QR code that people can scan with their camera phones or smartphones, and it'll go to a screen. I'm going to show you the screen in a minute where they can register to vote and do other things. But they can also, if they don't have a smartphone, they can text vote SW. Now that changes. Some say like vote this college. You can change it to anything, but we use the term vote SW because we're social workers. Vote SW to 34444, and they'll get the same screen. So that's what we've mainly been using as social workers. There's a picture of it. It's free. I mean, that's the great thing about it. When you order it, the first 9 are free. It tracks the number of registrations that are made by the provider, and it tracks the overall number of mail-in ballots requested as well. So that's how we've been able to track, that's how we were able to track that 40,000. One of the big anxieties, and Cheryl's probably going to talk a little bit more about this in her segment, is how do you actually integrate this into practice? How can I actually talk about this with my clients without being intrusive or without ruining the therapeutic relationship, for instance? There are so many ways you can integrate this. Two of the most common are the client actually notices it and says, what is that around your neck? And then you can say, this is a great way to register to vote, and you can help them register to vote. Now, Voteyard is a 501c3. It's a nonprofit. We participate in nonpartisan voter registration. So you don't have to worry about your agency thinking that you're doing something partisan. It's nonpartisan voter registration. The second way is to do this is to actually, I like to call it on your way out. So on your way out, you can say like, I know that things are really kind of bonkers with COVID. And so you may be forgetting, like, did you register to vote? So it's a really good way to, and we have sample scripts like the one here on how you can integrate that into your practice. So when you scan a QR code, it'll take you to this screen that you see right here. It'll take you to, you can register to vote. Some deadlines have passed, of course, but some you can still register. It'll tell you that it's connected to TurboVote, which is one of our partners. Vote today to see if you can request a mail-in ballot or to see where you can vote early. Some states have you can vote early, and then there's triple your vote, which I'm going to get to in a little bit. But it's basically a way to remind people, to remind friends and people in your network to vote. It's available in Spanish. You can track your ballot and you can see who and what is on your ballot. It's really, really nifty. After 10/20, when a lot of the voter registration deadlines have passed, it'll go to, do you want to vote today or do you want to triple your vote? I just wanted to show you that 10/20 is arriving very soon. A little bit about voter tripling. Tripling your vote is a really great, cheap, so it's cost-effective way of securing a promise from your friends to encourage 3 other friends to vote and follow up with friendly text reminders. So we'll actually help facilitate that process. If you sign up, I will give the link shortly. But the tactic is based on behavioral science research and has been validated to statistically increase turnout for a fraction of the cost of other tactics. And it's really meant for non-activists. And for those 97% of voters are going to cast their ballot and they're not going to think that they don't volunteer. So it's a really easy, really immediate way to engage people in voting. And there's the screen. If you want to set it up with Voteyard, remind your friends, you just fill out a form and we'll get you set up on tripling the vote. A lot of you are probably thinking, I'm working at home or I'm working at my office, but I'm not really seeing clients. I'm just doing telehealth. How do I do this? Can I still use this tool? The answer is yes, you can still use this tool. Actually, if I put this up and you were to put your smartphone you could scan it and it would work. So it does work for telehealth, but you could also do the text messaging as well. We have a page. I will give the link. But I suggest for you to bookmark it, and then to prompt the conversation. Like I said, I love the technique before you go, which have you remember to register. Are you ready to vote? There are many ways you can do this. We supply some of the scripts to make it easy for you. Unfortunately, some of you may not have time to order this, or it's too late to order this. The election's in less than 3 weeks. What do I do? Well, we have something called a democracy stat toolbox, which is a way to get this, but digitally. So there are 3 ways you can do that. One, you can change your phone background so that if you're comfortable, you can have the text vote SW to 344 and the QR code, and you can have people scan your phone either in person. If you're not comfortable with that though, there's another technique where you can use an email signature, which has the same option of, do you want to click here to register, check your mail-in ballot, just a simple signature. This is shown to be very, very effective, especially for those that email clients and communities. And lastly, especially if you're not comfortable with using your phone, you can just do it the old-fashioned way, which is just printing it out and just having it on hand as print. This is one of my favorite graphics because I think it really helps you set up a way to talk about voting safely with your clients and communities. There are 3 main ways you can kind of divide this conversation. You can say, well, I want you to be able to vote safely, but to do that, you have to plan to vote. So here are 3 options. 1, you can vote early by mail. We recommend submitting a mail application for absentee ballot no later than 2 weeks before election day. So better get on it. If it's now, you better get on it requesting that absentee ballot. Remember, request early and return early. So that's the first option. The second option is you can vote early in person, very little risk, all depends on your health status. And then the last option, we try not to recommend this option too much because it technically is the least safe. You have a greater chance of getting COVID. But if you do have to vote on election day, please do arrive on the polls when you can avoid lines, wear a mask, and stay socially distanced. So these are really good ways to talk to your clients and communities about making a plan to vote safely. Also, I am leading an initiative associated with tripling the votes, which is social work text banking. It's this weekend at 2 times, 3 to 4 Eastern and 5 to 6 Eastern on Saturday, Sunday, respectively. It's a really great way to get people in your network to vote, either to register to vote or to make sure they've mailed in their ballot or they're voting early or they're going to vote in person. I'm going to put the link in the chat. So if any of you want to sign up, please do. I'm going to be sending reminders out on Friday. So please, I hope you'll sign up for this. You don't need to be a social worker. It's geared to social workers, but you don't need to necessarily be a social worker to sign up for this. We have a lot of websites. I can put them in the chat too. One is our Watch It video, Watch It to get training on how to use the kit. Another one is our social work landing page. We also have our telehealth, which I showed you earlier. We have scripts. Now the scripts, because most of our providers are healthcare providers, it's going to use the word patient a lot, but you can easily substitute that with client or community member or anyone you're working with. They're very easily adaptable. We also have a social work toolkit that we started over the summer and that you can use to post in social media. It's really great to get engaged via social media. I'm very engaged in social media. There's additional resources in terms of scripts, posters that you can adapt. The democracy stat that I was talking about in case you want to get this, but digitally. And then there's the website for tripling the vote. And you should definitely follow us on Twitter and on Instagram. And that's it.
Thank you so much, Alberto. That was fascinating and so also so inspiring. I feel really jazzed up. I wrote down a million things and then you said you were putting it all in the chat, which obviously, but you know, I didn't think of it in the moment, but it was so exciting. And also something that just kind of blew my mind was right from the get-go, like I had not thought of the possibility of registering people to vote in all of the settings that you described and linking it directly to the healthcare setting never crossed my mind. That you might say to somebody, oh, and by the way, you know, have you registered to vote? And the argument that you made that Mimi had also mentioned was this business of how much it supports individual and community resiliency. And then when you link that, it's a no-brainer. It's actually an intervention, you know, for physical and mental health, which I just had not, somehow that just blew my mind. So, and I see Mimi nodding, which I know was the point that she was making too, but okay, it just got into my thick skull. So thank you for that. Also, I really liked your emphasis on the diversity of voices and all of that. That was so exciting. And for our students and our practitioners out there, it seems like such an easy thing to do. It's such a no-brainer, you know, and it's such a way to actually feel better and more engaged about things. When Mimi was talking in the beginning, I was beginning to feel like, oh my God, this is such an uphill battle. And then she left me feeling more hopeful. And now, Alberto, I feel like you left me feeling even more hopeful. I can hardly wait to get off Zoom and start to get active, but I'll wait till the end. Anyway, we're getting towards the end. We have our last speaker, Cheryl. Thank you, Aguilar. Thank you so much for hanging in there, everybody. This has just been great. And after this, we'll do some Q&A, and it looks like there's some messages coming up in the chat, but now I'm chatting, so I'm not checking the chat. I'm going to sign off. Cheryl, thank you so much, and see you all at the chat.
Cheryl, you're muted.
Sure. I was actually just asking, can you all hear me? Give me a thumbs up. I'm like, why isn't everyone giving me a thumbs up? Hi, everyone. So great to be with you all today. And I was just kind of sitting here thinking, I wish I would have had this presentation when I first was in school or when I came out of school, because even though I don't like being part of negative statistics, oftentimes I find myself in those situations where I am a negative statistic. And by that, I mean, related to this topic that we're going to talk about, is that I was among the social workers who believed that there was lines that we needed to stay in. If you were clinical, there were that line, that place that you needed to stay in, that little bubble. If you were macro, that was that line. And I've been really reflecting on why that has been the case. And I know that my experience going into social work school was an experience in which we're all, in some schools, we're made to make a decision on whether we were micro or macro. And I think that's part of where the challenge begins, when we are conditioned and we start believing that there's no place for us in other areas. If we go to the next slide, one of the things that we'll know, and I think I'm probably just gonna reinforce a lot of the things that my colleagues have already said. I think by now you're all convinced that this is a thing we must do. And what I'm gonna help answer is how I've been able to do this in my own practice, and integrating some of the techniques that I've learned from colleagues like the presenters that we have had today, and my own testing of strategies on how do I want to engage clients. So if we kind of come back to why we're social workers, I know for me, one of the reasons that I came to this field was to help people. When I wanted to figure out a way that I can help people in greater ways, someone led me to social work. I really didn't know what social work was until somebody sat me down. And my goal was always to be a psychotherapist, to be able to provide therapeutic interventions in Spanish or cultural competence interventions for the communities that I was serving. I'm a social worker based out of DC, and I specialize in working with immigrants and refugees. And when we talk about lack of services or disparity in mental health services and health, underserved communities like immigrants, communities of color, Black, and many other communities are often the ones more impacted by mental health. So when I began my journey in clinical social work or as a psychotherapist, and I was really rigid in my thinking around, I must do clinical social work in this space, and that's what I need to do, and I am not able to talk about other things in this space, I soon discovered, and it was probably around my first sessions with clients, that there's no way we do not integrate macro and meso in micro, that there's no way I can actually do the work, the clinical work I wanted to do without advocating for clients, without engaging clients in their advocacy, because very quickly into this work, I realized that many of the clinical issues that my clients had were connected to environmental issues. If we talk about immigration, for instance, I work with many clients who are immigrants who are undocumented. Part of their healing is dependent upon comprehensive immigration reform, or dependent upon reforms and policies that give them freedom, that give them access. So very early on in this work, I learned that I needed to challenge some of my own thinking, and I turned to the research and literature about how do I go about and do this. One of the biggest, I'm going to use the word weapon for lack of a better word, and I'm not thinking of a better one than this one, but one of the biggest weapons we have is our code of ethics. When in doubt, we turn to our code of ethics, and our code of ethics guide us on what to do. And what the research says about clinical social workers kind of staying in their lane and not engaging in voter social work is that most social workers believe they're not able to move over to the other lane, and also that agencies may not support voter engagement efforts. And I worked at an agency where oftentimes a few years ago, before my own practice, I had to pull up the code of ethics and say, and I used the code of ethics to advocate for practices that I felt like I as a social worker needed to do in that particular setting. So if we look at that code of ethics from NASW, it calls us to facilitate informed participation by the public in shaping social policies and institutions. We also have a clinical association of social workers. Their code of ethics calls us to do the same, points to clinical social workers' responsibilities to the community, noting that clinical social workers recognize a responsibility to participate in activities leading towards improved social conditions. And one of the things that we heard earlier today is that voting is social work. And in social work, part of our identity is the helping role. And when we're talking about the helping role, we're talking about helping clients relieve symptoms of distress, helping clients connect with services that are going to alleviate the stress and improve their lives, helping clients with information. So when we think about those of them combined, voter as social work as voter engagement and social work identity, is all embedded within our identity. If we go to the next slide, one of the things that has happened in the pandemic is it has made it, I think, easier to have these conversations with clients in sessions, is that everyone is talking about any of these issues, at least any of the clients, all the clients that I am working with. So I wanted to take a quick poll, and by that you can either just think about this question, or if you want to share your response by chat, you can. So how many of you have helped clients or community members or maybe other students process or talk about, or you've lent an ear for someone to talk about any of these challenges here? And if you want to just say me, or name the different challenge that you have helped someone with, or that you may be experiencing yourself. Okay, I'm looking at the chat. So you can just imagine that. But the answer to that is many of us right now, whether we're in clinical setting or outside of clinical setting, this is part of the daily conversations we're having. And it lends an opportunity for us to intervene as we hear people talk about this distress. And there's an opportunity for us to ask the questions that Alberto mentioned earlier. Have you registered to vote? For some people, and I'm going to use myself as an example, I would say my style is non-direct. I'm not directive at all. I am more, you know, I meet the person where they're at, which is what we're taught to do. And I find opportunities for engagement, and I may use more covert strategies than overt. If we go to the next slide, I'll talk a little bit more about that. But Alberto, you may be pleased to hear that I actually used this strategy, your strategy that you suggested this past week. I've never really done that in the way that you presented it, but I did. And I can tell you that when I did it, it became easier to do session after session. That question about, I didn't ask, are you registered to vote? I asked, do you have a plan for voting? As we get closer, that's a question that for me worked. I think we all have to kind of honor our unique styles and how we use all the information that we have today and tweak it to reflect how we will do our work. If we go to the next slide, let's see. So the covert and overt strategies is something that I started to practice when I was at the other agency I mentioned, where, you know, we had a lot of different restrictions about what we could do and couldn't do. And back then, and still now, one of the things we know about the therapeutic space is that we meet the client where they're at, and that is their space. We as therapists, as clinical social workers, we want to walk with the client where they want to take us. So we don't want to come in there with our agenda per se, but we want to be mindful and attentive for opportunities to intervene. And one of the things that I have learned about voter engagement and asking people about voting and whether they're registered or whether they have a plan is that voting itself is an intervention, as we've learned today. That could be a part of an intervention for someone whose challenge is directly connected to an environmental issue like poverty, like discrimination, and many of the other ones that we have talked about. I'm not quite sure if you can see me, but I think you can hear me. Can someone let me know if I'm still on? I noticed that I lost my screen.
You're still on. We can still hear you.
Okay.
We can hear you.
Okay, great. And hopefully people can still see my PowerPoint. Okay.
Yes, we can see
So,
that one as well.
all right. So this is what happens with technology. Sometimes it works and sometimes it doesn't. That's why I always have a backup plan. But with covert and overt strategies, covert strategies would be if you have, maybe if you are a non-direct person and you prefer not to directly ask a client about voter engagement or about any other thing, but you want to make sure that they know or they're aware about important information, you may use flyers. You may have flyers around your office. You may have signs. Now that we're doing a lot of things by video, you may have signs behind you. You may, if you're going to a clinic or if you're going to any other space, you may have information displayed openly for people to get information of an action or something that they must do. So that's more subtle. Some people may feel comfortable in that way. When, for instance, I work a lot with immigrants, and we know one of the things that we're learning about being involved in movements is that being involved in movements helps decrease symptoms of depression and anxiety, and it helps people have a higher sense of empowerment. So I always kind of wrestle with, do I let a client know there's a rally, or do I just put a flyer up and if they're interested, they're gonna go? So that's kind of how I use those strategies. You know, if you're looking at my slide right now, there's a point that I make, not our agenda to register voters in sessions, but respond to their expressed needs, challenges, crises, and desires. While I still agree with that statement, which I came up with myself, I gotta tell you that after being through many of these trainings myself, where I am a presenter, but I'm also learning from my colleagues who presented, I'm questioning that a little bit, and I think I have room to tweak that. While we're not coming to the session with our agenda and what we want to discuss, we want to be attentive. And one of the things that I started thinking in this clinical work, we have really big assessments that we ask clients. We ask clients very intrusive questions, a lot of questions about themselves, about their lives, about their past history, about their childhood, about their trauma. Why not ask that simple question? Are you registered to vote? How come that is not part of some of our assessments? If it's It says connected, it's voting is connected to our well-being. So I myself often have to challenge some of the thoughts that I have, and I evolve with some of the information that I learned from my colleagues. With all the interventions that we're learning in school and that we're going to hone on in later on and build an expertise around, many of them lend for being able to engage clients on voter engagement. Psychoeducation, that's one of the things that we do initially in sessions, and we're always educating clients, informing them about the diagnosis, informing them about the interventions that we're going to use. So psychoeducation in voter engagement could be, here are some of the sites where you can register to vote. Here's a link for early registration site. Here's a link for getting your mail-in ballots. So I see sharing information around voter engagement as part of psychoeducation. And one of the things that I started with since the pandemic began is that I began to actively send clients information that may impact their life, that may be useful in a moment like this where many people are stressed out, when many people are frazzled, and our attention is going anywhere. I myself can tell you that I have to put on my calendar, because many of us are driven by calendars, to fill out my mailing ballot. And my husband and I are going to make an event around that, and we're going to take pictures, and we're going to cook a nice dinner. But we have to. Right now, our minds is being pulled in many different directions, and we have to be organized, and we have to help our clients with building that plan. When we look at interventions like solution focus, where we're engaging clients in finding solutions for the problems they're facing, for the challenges they're facing, that's an intervention where it goes really nicely with engaging clients to register to vote. Like we discussed some of the issues that clients have on their minds right now, racism, discrimination, lack of access to things, fearfulness around elections. One potential question that is social solutions focused phase is, do you have any ideas of something that you can do to change that? Or do you have any ideas of what other people have done to change that? And we kind of start testing and allowing the clients to think out loud of things that they can do. Person-centered care, and I'm just gonna not go in depth into all of them, but I'm just gonna mention a few, and I'll let you kind of do a little bit more research on each and one of them. Person-centered care, we stay with the client where they're at, and they lead us to where they wanna go. And a lot of times, clients are leading us to ask those questions, but we have to mindfully be present with clients to be able to pinpoint that. For instance, one of the challenges that I hear over and over in sessions right now is, I am so overwhelmed. I am forgetting things. I'm gonna share with you some of the themes. I am so overwhelmed. I am forgetting things. I have so much on my plate. I need help. All of those distresses allows us an opportunity to ask and help clients plan. One of the things that we know about anxiety is that anxiety thrives on not knowing. Anxiety thrives when we don't have a plan. So we want to help clients have a plan. Narrative therapy, one of the themes that has come up in other trainings, and one of the concerns that has come up in other trainings, is people being afraid around if I send my ballot, would it get lost? Because that's a narrative that they're hearing in the media. That's a narrative that we're hearing politically, that your mailing ballots are going to get lost. And we know how powerful constant messages are, and we want to make sure that clients do not adopt that narrative as their own narrative. And we want to be able to allow clients to mindfully challenge that narrative and walk them through, if that was to happen, what do you think happens in a democracy? So we don't want people to be stuck in fear. We want to allow them to be able to test the evidence, whether those things will happen, and what can we do if, in fact, those fears do become true. With CBT, which is one of the interventions that many of us learn while we're in graduate school, testing the evidence, challenging that thought, what are other possibilities, lends itself for engaging clients when they're fearful around politics. So we go to the next slide. Sorry, I'm like looking at my computer waiting for that slide to move, and I realized I am not connected on the computer anymore. So you may have the new slide, what voter engagement opportunities may look like in session. So solution focus, and that's one that I encourage you to learn a little bit more about if you have not taken that class yet. The questions that we're asking are positively directed and they're goal oriented. So that's another opportunity for us to ask about that plan. How do you plan to do it? Do you know where to go? Do you know what's going to happen? Whether if you decide to go in person, do early registration, do you have a plan for that? So we're helping clients meet their goals by creating feasible steps towards them. We want to instill hopefulness. We want to, there's many people who are hopeless right now, who are feeling hopeless, who are very afraid. We want to be able to tap into that hope that people still have, but sometimes it kind of stays on the unconscious or it stays very hidden because people are really afraid. We want to ask about what gives you hope that this problem can be solved. Sometimes when we're in fear and something directly impacts us, we may feel like we're alone. So we want to help people come out of that shadow, come out of that little cave that sometimes we stay in, and allow people to see that they're not in it alone, that we're in it together. And one of the things that we have learned in the pandemic, and we know about healing, is that when there's shared trauma, when there's shared pain, there's also shared healing. So for many people, and the reason, and one of the ways that I connect this with politics and voter engagement is that together we can do so much more. And for the people who are afraid about our democracy and what the next few months will look like, or the next year or so will look like, bringing it back to this idea of togetherness. And you'll find an opportunity on how to do that in session, trust me. When people are feeling disempowered, just engaging them around what have they found to be helpful when they're feeling disempowered? What have they found to have worked for them? What do they know works for other people? Sometimes when we're in so much distress, we can't really think about what has worked for us, but we can kind of bring ourselves outside of ourselves and think about what has helped other people. That question, what do we know to be true, is a question that has worked for me really well right now as people are processing politics in sessions. And for, I'm sure some of you may have had clinical internships, or you may be on clinical internships now or will be very soon. One of the things that we notice and that we know is that politics directly connects with our mental health. We, as part of an agency I worked at, we created a program called Emotions and Politics, specifically to help people normalize what they were experiencing due to the political environment. So it is real. People are feeling anxious, people are feeling depressed, people are feeling in constant hypervigilance, and so it is real. So here's an example of how we may connect in session, how we may connect voter engagement in session. So I'll read it out loud and you have it in your PowerPoint. You mentioned feeling overwhelmed with getting around and getting things done during the pandemic. Have you made a plan on how you will cast your vote this year? Safety planning or planning is something that is paramount with the work that we do. I'm constantly helping clients with safety planning around suicidal ideation. I'm constantly helping clients with planning about what could happen to them and their families if they get deported in the case of immigrants who are undocumented. So this is the same case for the work that we're doing. So how do we put this into practice? If we go to the next slide, we'll learn that we become curious. We ask questions to the people that we are exposed to. I am really grateful to be a part of this network where I have colleagues who really understand these issues and who can redirect me or inform me if I have questions. And we turn to research, we turn to literature. Scholar spends lots of time doing research to give us answers for many of the questions that we have. Be creative. Right now, you have a lot of information. You have different tools that have been provided to us. You have different websites. You have lots of wealth of information. Be creative and figure out how do you use it in a way that reflects your style and in a way that reflects the work that you're doing. Be flexible. There's many clients and there's many community members, or there's many friends and family members who are not one size fits all. Some people may prefer to text that number that Alberto mentioned. Some people may prefer to get a link. Some people may prefer to get something in the mail. Kind of learn about your client and figure out how to tweak an intervention for that person. So we're known to be nonpartisan. And I'm kind of smiling now. You're not able to see me. But I have to say a side note that we know social workers have political views, and we know social workers pick parties, and we know all of that. We don't want to say that in the session. We don't want our clients to know exactly how we feel about politics and how we feel about what we're experiencing. Clients become curious. My clients want to know. My clients want to know who I'm voting for. My clients want to know where I stand on issues. There are things that if it's related to clinical issues, I may choose after reflection whether I disclose something or not. But in terms of my political affiliation, that is something, if they Google me, they will find out. But they may not necessarily find out from me because I'm saying it in a session. And when they ask that question, I may reflect it back to them and ask, I'm curious about that question and what information may be important for you to know. So sometimes they just want to understand that we understand their issues. And bring it back. So it's a balance to stay with the client when they're becoming inquisitive about your political views. And we're going to be with them. We're going to help them process that. We're going to see what kind of questions they have and the intention of the question. And then we're going to bring it back to what the clinical issue was. If we go to the next slide, some ethical considerations for us. Let's continue to engage in ongoing exploration and self-evaluation. When I tell myself sometimes that I am my best client, and sometimes I can do a little bit of black and white thinking, all or nothing thinking. And we know there's always an opportunity to come back to the middle when we're thinking in those terms. Like when I used to think, I cannot ask these questions in therapy. And it was based out of not knowing, and it was based out of not having enough information. So when we're finding ourselves in very extreme terms, come back to the middle and find that information that we're missing that would allow us to make a different decision. As you self-reflect, considering how you may be able to affect change. Check in with your own assumptions, as we have been kind of talking about, or feelings regarding your role concerning voter engagement. After today, there may be some people, and after the trainings that we've done, there may be some people who process this, who self-reflect, and they may still say, I don't feel comfortable engaging clients in this way. But there's so many other things, as we learned earlier today, that we can do. We can engage community members. We can use social media. I just shared, and I don't like to multitask, but I was so excited to learn about the social work, the social worker engagement bank this weekend, that I shared it on my Facebook right away while Alberto was talking. So there's many tools at our disposal, and for some people who still need some time to process and decide whether you're going to engage clients actively in your sessions, or as you're thinking about how you may engage clients in the future, think about other ways you can affect change if it's not in your sessions. If you're exploring efforts outside of your own practice, this is the self-care advocate in me. Consider your emotional bandwidth. So sometimes we may think, all right, if I do something outside of work, that may be better because I don't want to engage my clients, but we may not have that emotional bandwidth. So as social workers, one thing that is important for us is to constantly take assessment of our own emotional bandwidth and our self-care to prevent burnout and vicarious trauma and all of that. If there's a drive to do more, it's important that we do it, and then we're honoring our body, and then we're honoring ourselves, and when we have done too much and we are burning out. So just to kind of recap, there's many social media outlets and voter engagement, the ones that we all learned today. I hope you all save them and engage very soon. And for some of you who work in agencies or who plan to work in agencies or who are thinking about the future, if one of the things I tell other colleagues, if you feel like this is not something that you want to engage in, if there's someone else within your practice, if there's someone else within your organization, within your agency, within the school setting who can have that role. Throughout the years, I have been convinced that our clients need information, and the more I have practiced on how to ask that question, the more I have reframed what asking about voter engagement means, the easier it becomes for me to engage clients. When I started this past year to engaging clients on voter engagement, my approach was more non-direct. I was looking for those opportunities and I was pitching in. As we're getting closer to elections, I sense the urgency and I'm asking more directly, do you have a plan for voting? And that will lead to someone saying, I'm not even registered to vote. So then that's when we go and help them with a plan. So I know that we're gonna go into questions, and I'm happy to answer any questions any of you may have.
Oh wait, I wasn't muted that whole time. My God, good thing I wasn't talking to myself. Cheryl, that was so exciting. Wait, can everybody hear me now? I'm a little confused. Okay.
Yep.
Cheryl, thank you so much. And I've got to say, my mind is just really just like going, and one of the things that I really appreciated was your normalizing political practice as a form of, mental health or clinical social work. And the way that you described doing psychoeducation or safety planning or whatever it was around voting, for example, just really just integrates it into what is already good practice and stuff that we know how to do. And so I thought that was really interesting, and also minimizing the distance around our own discomfort about asking people about their politics. So in class, students often ask a lot of questions about or express some discomfort around asking clients about certain topics like their finances or their sexual engagement, so forth. And politics ends up being in that category as well, not just in the classroom, but also even faculty. It's something that we talk about a lot, like what is our comfort level talking about this? And I feel that what you just gave us was so normalizing and empowering for all of us listening about how to engage with this topic, which, now more than ever is really in our face and really, really crucial. And when you talk about your clients expressing feeling overwhelmed and forgetful and, not on top of their game, whatever, let's just say that I was chatting earlier with one of the organizers of this panel, and we were both saying how we were experiencing some of that even this semester, and how comforting it is to know, again, we're not alone. This is what's happening under these specific circumstances. So again, also just the melding of the micro and the macro across the three presentations, I think is really brilliant and exciting for the future of our profession. And hopefully that'll really, come to roost for the listeners as well. So anyway, those are my views. And I have a bunch of questions, but I don't want to, monopolize. So I think that Nicole is back with us. Thank you again, Nicole, for all your tech support. And I think I'll wait a couple of minutes, but I do have one question. I'll start us off with one question and we'll see what comes of this. And this is really to all three of you, which is, as you can tell, I'm really jazzed up by this topic. So I feel like I've been given so much, and I'm just wondering how the three of you, maintain your sense of commitment, and how do you boost your resilience? I mean, it's an uphill battle for all of us right now. And I'm just wondering if you can share some of your own tips for how you've remained committed to the work that you do, which is, unusual in our field and never more important. So you could speak to that.
Well, I'll try to go first since it's silent. I always jump into silent spaces. So I think I don't know if this is how I maintain it, but it's been very important for me to be co-leading this campaign, voter mobilization, because every day I feel like I'm doing something I don't know that may be making a difference. And being invited to participate in these webinars, and many of us on our team have been invited to do these things, so we feel like we're making an impact around the country. And I think both Alberto and Cheryl gave lots of examples of interventions at other levels that keep your spirit up, because if you feel like you're doing something, you feel effective, you feel what's the word, sort of inspired, motivated, and we'll see what happens after November 3rd. But yes, that may change everything in one way or the other. But it's, so I think finding speaking to the group as a whole, finding any one of the tools that you've been told about on this webinar, and there are tons, and many of the Voter ER items are on our website. We have a link to the Voter ER website on our website and vice versa, so you can get to both of us back and forth. If you need a boost, try one of these tools, because I think it'll make a difference. Mm-hmm. And it's the engagement, being engaged in what's going on around us. Cheryl, you said it, how you discuss with people clinically. Well, I think that applies even in everyday life.
Thank you, Mimi. Cheryl, I could hear you sort of, beginning to answer a little bit. Do you have some thoughts to share also?
Yeah, I think for me, it's kind of personal. I think many of the issues that our clients face are issues that I face myself. And I think just when you think, for me, in my experience, that I am kind of like done, there's no way of being done, because we learn things like women at a detention center being forced to have sterilizations. We see all the injustices that are happening in our community. So it's hard to be able to stay connected to a lot of these issues sometimes when they hit very closely home, many of them. But sometimes it feels like there's no option. There's no other option when you see neighbors, when you see colleagues, when you see friends, when you see relatives who are impacted by the policies that are being created and not defeated, and when we see the racist and hateful rhetoric in our country. So it's I think my clients are also my inspiration. Every time someone shares a story and I see the connection to something that is happening, and they may feel like they need more allies, I want to be that ally. I may not let them know that I'm out rallying out there while wearing a mask or multiple masks, but I know deep inside that I'm helping support and being an ally to that client and to a family member or to whoever may be impacted by the issues we're seeing.
Yeah, sure. I think that's a great point. And it sounds like the two of you are actually talking about a lot of the same thing, like the kind of strength that you get from the work that you're doing for, a variety of reasons. Alberto, is there anything you wanted to add to that?
Yeah, everything to me is tied to social justice. That is the overall value. It's in our code of ethics. It's one of the central values of social work. And to me, that's what this work is tied to. Like I said at the beginning, what got me into this work was this feeling of powerlessness, that I wouldn't be able to do the kind of direct action, community organizing that I thought I could do. I am doing it. I'm just doing it in a different form. I'm doing it digitally. I'm doing it more interpersonally. but I'm still doing organizing. I'm still organizing. So to me, I think resilience is about being able to roll with the punches and to be adaptable. And that's what I've had to be during this whole epidemic. And I mean, not just this COVID-19 epidemic, but this epidemic of systemic racism. I thought I was gonna have a meltdown when 1 week after another, it was George Floyd, Rayshard Brooks, Breonna Taylor, like 1 week after another, Black and brown lives being murdered by law enforcement. It was one point where I thought I was gonna like physically have a meltdown and mentally have a meltdown. And I knew that I needed to, whatever work I was doing, I was still doing VOTR work during this time. I knew that what I was doing, I just needed to anchor it towards eliminating systemic racism. So let me get more informed about voter suppression tactics, so that, because I know so many voter suppression tactics are built on systemic racism. So let me connect that. So I had to like really kind of adapt and place myself and place what I was doing within the context of the issue that was really that was going to tear me down. And I needed to feel that I was still doing something about the issue, which is very large an issue. I can't do it alone. But I felt a sense of unity and solidarity and being able to do this work, which is about making sure that marginalized voices, including Black and brown people, can have a voice, and can, if an administration or a politician or an official is condoning white supremacy, is not saying white supremacy is wrong, then we need to be able to say, vote them out, or to say, this is not in accordance with my values. This is not in accordance with American democracy. So that's probably the most pointed political remark I will make during this whole, but I'm saying it because in order for myself to feel a sense of resilience, I need to be able to directly respond to what's happening and feel a sense of solidarity with others.
Thank you, thank you. And I think that ties in really nicely also with what Cheryl was saying about the strength that we get from that feeling of togetherness as well. And it also made me think of what Mimi said right in the beginning of your talk, where you said, why are we doing this or whatever? And your answer was, it's the right thing to do. I mean, we are in a values-based profession. And, for some of us, it's very sustaining to be part of that. So now I'm looking at the chat, and it does seem that there's a gazillion comments. So Nicole is always really good at managing this part. So I'm more than happy to hand over the baton.
So Melanie asked a question about, is there a link that can guide one on how to fill out the ballot so that they are ready once they arrive at the voting site? So is there anything that can actually help them when they're filling out the ballot? They can be really confusing. So do any of the presenters know about any resource like that?
Well, I'm not sure. We have all sorts of tools. That's a very, very specific request. I think that might be on our voting resources, part of our webinar, of our website. Also, if you're in New York State, if you go to New York City Board of Elections, there's all sorts of information like that that will help people do that very specific task. And I know I got a voter guide in the mail, so people are sending this information out as well. But you have to just keep your eye out for it or search for it. And you can try our website or try New York City Board of Elections. They have lots of information there.
Great. Thank you. So Professor George Moses posed a question, thinking like a student. If you still feel uncomfortable talking about politics, and some of the presenters discussed this, but how do you do that in a conversation with a client and not take a side of a Democrat or a Republican? What tips do you have, quick tips for social workers out there in the field?
That's a great question. And when I'm like deep breathing as I'm listening to that question, because it is really hard to not take a side. It is really hard to not go along with the client and say, yes, this really sucks. Yes. I'll use myself as an example of what I do. I think clients come to me because they know my politics. I think clients are really smart. They research who they're going to work with. There are some clients that I wonder about in terms of where their politics are at, and I am a lot more reserved and in what I may say, even in what interventions I may use based on, you know, if I feel like I may offend them. And I think that's the question, and I'm seeing it in the chat. Should we stay nonpartisan? Should we not share our political views? And I think that's a question that we should be asking ourselves. There was a big debate right now, big controversy that NASW put out a banner, social workers for Biden. And you know, it causes a lot of controversy, but I think we have our code of ethics to guide us on many things. One of the things that I want to challenge is that sometimes I feel like we take the social out of social work, and part of us as social workers, we have to be so careful. And I'm not saying break the rules. I'm not saying that at all, but we have to be so careful. Sometimes I feel like we have to hide ourselves, our authentic self, because we have so many rules and regulations and ethics about how we ought to show up in our space. But I think clients, and I think as a community, we really need to challenge and think out loud and brainstorm as a community. How do we move these conversations forward? How do we present ourselves in a more authentic way with clients? And how do we have safe conversations about things that may be important for us as well? So right now, I don't necessarily have the answer for that. I can tell you that many times I just have to debrief a lot in sessions because I totally agree with what a client is saying. And I just have to kind of bring it back to the client. But there are many times that I have the urge to say, and sometimes I have said, I mean, immigration is, I work with a lot of immigrants who are undocumented. I mean, I do have ally with them saying that is really unfair. That is, I may reflect back, but what I do is I reflect back to what they're saying. So it's more like their voice, and I'm elevating their voice as opposed to my own opinion. So that's kind of how I deal with that. I don't know if you answer the question, but it's a very valid question.
Great, thank you. It looks like Professor Kolb responded that she tells students when asked that she supports policies and policy advocates that are consistent with social work values and ethics, which is similar to some of the things that you said. And Alberto, did you want to comment? I see you wrote something in the chat.
Yeah, I understand, because I see all this, like, you know, how can we actually stay nonpartisan? You know, my political views are based on my ethical principles, or they're often based on social work principles. To me, I think it's often inevitable that politics are going to come out in some way. I mean, Cheryl's even alluded to, like, some clients, they come to her because of her politics. They're aware. I think what's more important is that, not that you're so nonpartisan, but it's that you don't push your political views and beliefs onto others, that you don't impose. It's like, you know, when you know, I'm not a clinician, but when they talk often about transference, and, you know, like, or about making sure that you don't push certain opinions or certain judgments, that you try to stay quote unquote neutral, or, you know, I think it's similar to that, in that you're not trying to push them to believe a certain way. Like, for example, when you're not a therapist, you may be on the Republican Town Council and Republican City Council. And I'm personally, if I'm seeking a therapist, if they're Republican, whatever, I'm not, like, as long as they don't shove it down my throat, then I'm fine. I'm fine with having a therapist who's a Republican. This is me personally, you know, even though I'm not a Republican, that's different from my own political views. I'm not conservative, but I'm more concerned with that whatever I tell them, that it will be through some kind of ideological lens, or some kind of purity test, or something like that. So I'm more concerned with the not pushing it on other people. That's what I'm concerned from a clinical standpoint. That's what I'm more concerned with.
And I feel like, if you don't mind, I feel like one of the things that's really come through is if we do treat politics and voting and all of this as just another area for clinical work and for intervention, then it's exactly what Alberto said, which is that, you know, there are things that we engage with and we remain authentic, but we're not necessarily saying everything, and we're not going to be the same as our clients. They're, you know, religious or, you know, not religious, for example, you know, whatever it is, or age or gender or whatever, you know, there are differences, and we maintain that same professional posture in relation to all these things. And the big takeaway for me, again, is that politics has been normalized as an area of discussion through this workshop. So, you know, I think that your answers really support that.
I think as a former clinician, one of the hardest things is when someone will state their politics and it contradicts what their needs are as a client, right? So I worked in a hospital for a long time. Someone needs, you know, they're benefiting from the ACA, and they say, you know, they're voting for someone who doesn't support that. And so that can be a point of engagement in talking with clients. Gary Carter posted a reminder that the regulation that a 501c3 can't lobby or be partisan is a history of politics to suppress the voices of marginalized populations. And I think that that's a really important point. And so, you know, having these discussions with clients at the micro level is in a way our form of advocacy. Sorry. Others want to comment or add to that? Cheryl, it sounded like you were going to say something.
I'm agreeing to everyone's saying, because everything is on point. So you see me shaking my head a lot. I actually wanted to just uplift something that Alberto has said about we choose what we disclose with clients. And my rule is, if I disclose something and I get into a space where I'm noticing I'm taking space away from the client processing what he or she has to process, then I know I spend too much time sharing. So that's kind of like the check-in that we do. They may be curious. I may choose whether I self-disclose or not based on whether it's going to serve a clinical purpose. But the moment, and when we have those moments in the clinical space where we feel like, oh crap, I took too much space, we immediately come back and bring it back to the client. So I just wanted to kind of uplift that about when we choose to disclose and making sure that we keep it centered on the client.
If I could just add, you know, for the teachers in the room, the same issues, parallel issues come up in the classroom. Exactly, because the students want to know, they're not our clients, but in the same kind of relationship, they want to know what you think about this and that. And of course, in the classroom, it's clearer what you think about things. I mean, I teach social policy. It's very hard for people. It doesn't take more than 10 minutes for people to figure out what I think about the problems with our social welfare system. And I tell them at the beginning, especially during election seasons, that you know, we're going to have a critical review of the U.S. welfare state, but this goes beyond any one political candidate, and so we're not, you know, if you're welcome to talk about candidates, but I'm not going to talk about that, because these problems have been going on for 30 or 40 years, and so that's one way to learn that without having to hide your analysis, which is embedded in the readings and the questions you choose to talk about. So you have a little more leeway, I think, in the classroom, but really the same. You have to figure out what that balance is and what your comfort level is. And I don't know, are we still going on or what?
No, this is it. That I was about to say, Mimi, you kicked it off and now you're closing it out. It's 5 o'clock, so it's perfect. And I'll hand it off to Jessica. I see reappeared. So Jessica, if you have a few closing words, I hand it off. But thank you to everybody. I think this was so great and so informative, and I'm really excited personally. So, you know, everybody go vote and register, get your 3 friends to register and so forth. All of that was just so great. So thank you.
I just wanted to reiterate our thanks to the presenters and for everybody who was able to participate. And we will follow up with continuing education certificates for those folks who are licensed social workers and who are needing that. And if you have anybody who might be interested in this presentation but was not able to attend at this time, we have recorded this and it will be posted on the Bronx Social Work Education Consortium website as
Also,
soon as possible.
could you send it to us as a link for those of us who don't check that website?
Absolutely. Yep. So thank you, everybody. Have a
Thank
good
you,
night.
guys.
Thank you so
Bye.
much. Take
Great.
care.
You have a good day.
Have a good
Thank
night.
you.
Thank
Bye.
you. Take care. Do we stay on for a link? I thought I saw Amanda said something.
Oh, yes.
I think it's in the chat, Anderson.
Yeah, I'm trying to.
I just reposted it.
Okay,
Okay.
good.
All right.
Nicole, I'll stay on to the end to keep you company.
Okay, thank you.
Or maybe people were just waiting for you to sign us off. Anderson, did you get the link? Okay, good. He must have.
I can take us to a breakout room.
No, I've got nothing to say. I was just keeping you company. I see Brian is a diehard. Oh no, he just signed out. Oh no, there he is again. Hi, Brian. Is that it? Are we signing off?
I think so. I think I'll sign us out.
All right, do it. Thank you, Nicole, for all your fantastic tech
Thank
wizardry.
I was gonna make one comment. I got distracted because my alarm went off on my phone when I was saying something at the end, and
No, it was fine. It was great. It was great. You were great.
no, you did a great
No, you were great.
It's like an SNL.
No, you were great. You were greater. All right, I'm signing off. Bye.
Good night.
Bye.
Bye.